Okay, so today we will be talking about ibuprofen. Ibuprofen is one of the most common anti-inflammatories that is taken. Ibuprofen is the generic name. The trade names are Advil or Motrin, and here what the pills look like. It's all taken orally. The half-life is about 2 hours, and the onset of action is approximately 30 minutes. You don't need a loading dose, so you can just take it as needed. It's used for pain relief and an anti-inflammatory. It works by inhibiting the cyclooxygenase in your body, which is what makes inflammation in your body. So for adults, you should take 400 to 800 milligrams 3 to 4 times per day for inflammation, but take no more than 3,200 milligrams per day. So this is a bottle of generic ibuprofen, and it's for 200 milligrams. So I could take 2 or 3 or 4 of these for my inflammation. So for children, 6 months to 12 years of age, they can have 10 milligrams per kilogram of weight, but no more than 4 times per day. So for not just ibuprofen, but NSAIDs in general, adverse effects are GI irritation, heartburn, nausea, upper GI bleeding, gastric and duodenal ulcers, headaches, fluid retention, dizziness, liver and renal toxicity, but that one's not very common, hypersensitivity to NSAIDs, and increased bleeding time. So some drug interactions you can have are decreased effects of antihypertensive drugs and decreased antiplatelet use of aspirin. So you need to be careful if you're taking those drugs and ibuprofen at the same time. So patients that are taking ibuprofen or NSAIDs frequently should be monitored for their blood pressure, renal function, liver function tests, cardiovascular thrombotic events, and you should watch for signs of GI bleeding, prolonged bleeding, skin reaction, anemia, or visual disturbances. So Boots Laboratories is who developed ibuprofen in the first place, and a few companies that manufacture it now are Funding Solutions International Incorporated and Synergy Medical Incorporated. And that's all of our information on ibuprofen today.